Hey everyone, Paul Dealergy here with our last video presentation of the semester. I'm here with my wife Maria. She's going to be our model for today because we're going to be talking about clinical surface anatomy. If you don't know, I'm in dentistry, and one of the most important things that should be getting done every time you go to the dental office is an intraoral and an extraoral examination of the head and neck. Because that's so important, I'm going to use that as an example of my clinical application. So the first structure, which would or should be observed, is the occipital region. I'm looking for enlarged lymph nodes of the lymphatic system. Lymphadenopathy can indicate systemic or localized disease, and especially because we're talking about structures of the head and neck, it's that much more important. The next structure I would observe is the sternocleidomastoid of the muscle system. I'm going to again palpitate for nodular involvement, and we're going to feel up its anterior and then down its posterior border. The next structures I'm going to observe are the masseter and temporalis muscles. Both are muscles of mastication. I'm going to have my model Maria here clenched down, and I'm feeling for enlargement of these two muscles because enlargement can indicate severe bruxism, which can have dire effects on your teeth. The next structure which I would observe is the temporal mandibular joint. I'm going to have Maria open and close. And specifically what I'm looking for is luxation, subluxation, and deviation within the temporal mandibular joint. This again can have dire effects on the oral cavity. It can have effects on mastication and again bruxism as well. The next structures which are important to observe during an extraoral examination are the submandibular and sublingual glands of the digestive system. What we're feeling for is any inflammation or any enlargement in these glands. Salivary stones and viral infections can have a dramatic effect on the submandibular and sublingual glands. The next structure, or the last structure I should say, is the thyroid gland. The thyroid gland is part of the endocrine system, and the way we're going to locate that is first we're going to locate the thyroid cartilage, which is not prominent on Maria because she's a female. Once we find this cartilage, it should only be a few centimeters inferior, and the way to observe this gland is I'm going to put lateral pressure on one side, feel with my other hand, and then again lateral pressure, feel with the other hand for any nodular involvement. Another clinical application which we can use here in dentistry is using the mandible as an anatomical landmark for local anesthetic injections. The way that the angle of the mandible can become important is I'm going to take my index and middle finger and gently wrap it under the inferior border of the angle, and then I'm going to take my thumb, insert it into the oral vestibule here, and what I'm going to locate is the coronoid notch of the mandible. By bisecting these two structures, I can then take my needle and find the insertion point for my nerve block. Now, this particular nerve block would have been the inferior alveolar block, which is a nerve division of the trigeminal nerve. This is useful for working on posterior mandibular teeth. So that's all we have to talk about, and I hope you enjoyed today's video, the last of it. So thanks for the fun semester.